out of all mental disorders, there are some that make more sense than others. There's no doubt about that. For example, temporal lobe seizures are seizures that originate in the two temporal lobes of your brain. The temporal lobe processes emotions, fight or flight reactions, and are important for short-term memory. Some symptoms of a temporal lobe seizure may be related to these functions, including having odd feelings such as euphoria, fear, panic, and deja vu. During a temporal lobe seizure, you may remain partially conscious, or if the temporal lobe seizure is more intense, you may be unresponsive even though you look awake. You also may make repetitive movements of your lips and hands. Temporal lobe seizures may stem from an anatomical defect or scar, but the cause often remains unknown. Temporal lobe seizures may be resistant to anti-seizure medications. Surgery may be an option for some people who don't respond to medication. Now, I just watched this video by this, I believe he's an Indian guy. That's what he seems like anyway. I could be wrong. But I'll put his name in the comments or in the description. And it's important to note that this is from myoclinic.com, which is, I'm sure a lot of psychiatrists would agree that it's a decent, it's not the best source, but it's a decent source. My response to this, I've actually seen a lot of literature and videos on YouTube, information videos by doctors, like the one I'm gonna, I mentioned before, and I'm not gonna lie and say that their theory doesn't make sense. This is one of the more appealing theories to me. Like I say, there's some mental disorders that make more sense than others, and their argument is much more difficult to debate. But let's look at a few aspects of this. The proof that temporal lobe seizures actually exist are not really there. What we do know is that full body seizures and full body convulsions, we know that happens, that is real, that there's no denying that, and that's the type of behavior that you can't deny, that there's a problem with the brain, and there's no question about it. The problem here is for people who don't have any involuntary movement of the muscle, for people who don't have that, now we're dealing in the realm of theory. Okay, we can't accurately diagnose temporal lobe seizures in somebody who doesn't have involuntary movement of the muscle. And also I would go as far as to say it has to be consistent. If somebody has had that happen once or twice in their life, it could be chalked up to being cold. If you have the shivers, that now obviously isn't it. If you're having some kind of reaction, some kind of temporary reaction to prescription drugs or alcohol, that obviously isn't it. So there are a lot of other things that it could be. My main problem with this diagnosis that's given to people is that it's very theoretical, and unless you have that involuntary movement of the muscle, the infamous, unless you have that, there is no saying that's what it is. That's what it is. The other problem I have with it is that people, long time ago, people with seizures were considered prophets in many cases. Okay, so a lot of people in Christianity, a lot of the Christian prophets, I would go as far as to say, were people who had seizures. So it is my Christian belief that temporal lobe seizures have to do with strengthening some kind of connection with God. I think what they're describing is actually what is happening. The patients aren't having some kind of they're not mistaking what's going on. Okay, the way that we're connected with God has to do with emotions. The stronger emotion correlates with the stronger experience, which is something that has to do with God that people do not understand. So I think what they have done here is they've said, okay, these people feel like they're closer to God. Yes. The difference is not everybody with temporal lobe seizures is as articulate and smart as I am. So the experience that they have with God, they're not going to articulate it correctly. I'll end it right there.